Hey guys, it's Miss Hickson again, and so we want to talk about something that's probably on the forefront of most of our minds as we go into clinicals, is how to don and doff our personal protection equipment, or otherwise known as our PPE. And so the very first thing that we're going to do is wash our hands every time, right? If they are visibly soiled, then you are going to wash them with soap and water. But they actually recommend hand sanitizer. So we're going to wash our hands. You're going to do it, make sure you get in between your fingers, you're going to get the outsides of your hands, and you're also going to get your fingernail beds. So you're going to wash them just like this, 15 to 20 seconds. CDC is now recommending 20 seconds for any contact with COVID patients at the moment. So once we get our hands sanitized, we're going to put on our gown. And so some gowns are disposable, some are not, some will be washed. And so we will put on our gown. You want to be completely covered. We're going to tie it in the back. Sometimes it's good to have a friend. Get it tied. And this is important. And then we're going to wrap it around, make sure our backside is covered as well. And so tie it in the back. We want to make sure we're covered completely. So the next step is our mask or respirator. And so I have a couple of examples here. So here's a mask that actually has a face shield that is built into it like this. This is just a plain mask. We have an N95. And so we have one of these, and I have some just extra goggles. So whatever that facility has for you to use, obviously you're going to use that, right? Let's hope they have some. And so I want to demonstrate how to put on an N95. And so you're going to be fitted for an N95 mask once you get into a facility and are working there. For clinicals, you are not going to be going into any sort of negative pressure room, so you probably won't even be utilizing these. You'll just be using a regular mask. So the way you put on an N95 is you fit it to your face. There is a band across the top, and you're going to squeeze that to fit your nose. The top band, you're just going to go ahead and pull up onto your head. This step is important because a lot of people struggle with this. This band on the bottom is going to actually come up and around and back over your head like that. So what we're going to do now, again, is press down, make sure that that is sealed up, and make sure it fits around your face tightly. And then we're going to do a check. And so when I breathe in, I want to make sure that it is, I'm not getting in that outside air. And so you can kind of tell that, and then you're going to feel as well to feel if there's any air, moving in or out. And so we have that on. And then if I didn't have my glasses on today, I would be using these goggles, and this is when you place it on as well. And so now you have your goggles. But I can't see, so I'm putting my glasses back on. So you would have that on, and then what I do at this point is, again, I wash my hands because I have touched my face, I have touched myself, and you don't want to contaminate your patient with your germs either, right? So I'm going to wash my hands again, 20 seconds, blah, 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 blah. Good job. And then you're going to put your gloves on. These aren't sterile. These are just your gloves that come out. But the important thing that you need to do is make sure that your gloves come up and cover your ends of your gown. And so that's the important part here. So once you're gowned up, you don't touch anything. You don't touch your face. You try to, make sure your hair is pulled up where you're not having to touch your body in any way. And so this is the proper process of PPE per the CDC. And probably just as important as putting it on, it's just as important taking it off correctly, because this is where you can actually contaminate yourself, and you do not want to do that. And so I'm going to show you the way that I generally do it. I have downloaded 2 different ways to doff, but this is the way that I like to do it. and it's the gown and gloves first. And so what you're going to do is you're going to grasp your gown, the outside of your gown, and you're going to pull it and tear it. Most of these are tear away. It's going to tear it, the straps from the back and the straps from the waist. And so we're going to pull it to the front, and you're going to pull it off. And as you're pulling it off, you are curling it up in a ball. And you strip off your gloves. You can touch the inside that was up against your body and pull off the other one. And so now you have all of this, and you're going to discard it in the proper trash can, okay? So what's next? We're going to sanitize our hands, right? So we're going to wash our hands again, because this is probably the highest risk of you contaminating yourself, because you're going to take off your gown, your goggles and your mask. So wash those hands really, really, really good. And then if you have like the goggles on like this, some of them fit around your head, you're going to reach back and you're going to only touch that goggle part and pull it over. Some of those face shields are like that. If these were my goggles, then I'm going to touch just the side. I'm going to put them down, get rid of them. But I can't see without my glasses. And then the face mask is the same way. Don't touch it with your hands. Don't touch the first part. Pull it off and dispose of it, because truly they are not supposed to be recycled. And so then again, we are going to wash our hands, and ta-da, you just took care of that patient.